Nursing 474, Cultural Diversity in the Community. Here are your weekly learning objectives for week 2. They were presented in the first 2 PowerPoints. There are 6 steps to working effectively with immigrants. They are to know yourself, get to know the families and their help-seeking behaviors, get to know the communities that frequently interact with your clinical setting, get to know some of the traditional practices and remedies used by the families and communities, learn how a community deals with common illnesses or events, and try to see things from the viewpoint of the patient, family, and community. Recent changes in immigration laws have increased immigration to the United States. It is estimated that 12% of the total population is foreign-born. More than 2/3 of the foreign-born population lives in or around major metropolitan areas in 6 states. The 6 states are California, Texas, New York, Florida, Illinois, and New Jersey. Categories of immigrants include legal immigrants, refugees, non-immigrants who are admitted to the United States for a specific purpose for a specific period, such as tourists, students, temporary workers, business executives, diplomats, artists, entertainers, and reporters. The last category is unauthorized immigrants or undocumented or illegal aliens. Misperceptions about the economic value of allowing immigrants to enter or to stay in the United States are many. However, it is estimated that immigrants add about $10 billion to the economy annually, and that in their lifetime in the United States, an immigrant family will pay $80,000 more in taxes than they consume in services. People in the United States are ambivalent in their attitudes and policies about immigrants, and there continues to be some misunderstanding about what constitutes an immigrant. Nurses need to understand the traditional healing practices that their clients use, many of which have been proved effective and can be blended with traditional Western medicine. The key is to know what practices are being used so the blending can be knowledgeably done, and community members are excellent sources of this information. Nurses need to know the role of the family in immigrant populations and treat individuals within the context of families from which they come. This includes being aware of warning signs of family stress and tension across generations. Nurses need to be aware of the role of the community in the care of immigrants related to communication, crisis intervention, housing, emotional, and other forms of support. Community contacts can explain the cultural and religious beliefs that influence behaviors of immigrants. Cultural competence is a combination of culturally congruent behaviors, practice attitudes, and policies that allow nurses to use interpersonal communication, relationship skills, and behavioral flexibility to work effectively in cross-cultural situations. Culturally competent nursing care includes 4 principles that are listed on your slide. Nurses must work toward becoming culturally competent because nurses come from a variety of cultural backgrounds and have their own cultural traditions. Care that is not culturally competent may further increase the gap in racial and health disparities between minority and majority populations. And the specific Healthy People 2010 objectives for persons of different cultures need to be met. Therefore, client lifestyle and personal choices must be considered. In order to develop cultural competencies, which is one of the core competencies for public health nurses, an ongoing life process that focuses on understanding every aspect of client care is needed. Nurses develop cultural competence in different ways, but mainly through having experience with individuals of other cultures and being receptive to these experiences. Dimensions of cultural competence include nurses' integration of their professional care knowledge with the client's care knowledge and practices to negotiate and promote care that reflects the client's values. The nurse's decision and actions are guided by 4 modes of action. They are cultural preservation, cultural accommodation, cultural patterning, and cultural brokering. There are inhibitors to developing cultural competence. Stereotyping is the basis for ascribing certain beliefs and behaviors to groups without recognizing individual differences within the groups. Stereotyping blocks the willingness of people to be open and thus to learn about specific individuals or groups. Stereotypes can either be positive or negative. Prejudice and racism. Prejudice is the emotional manifestation of deeply held beliefs about their groups. It usually denotes negative attitudes. Some individuals believe that persons of particular race, skin color, cultural practice, or social standing are inferior and cannot benefit fully from society's offerings of education, good jobs, and community activities. To justify these beliefs, individuals may then deny persons who are different from themselves the opportunity to benefit from societal offerings. Negative feelings are usually precursors for discriminatory acts based on prejudging. Racism, a form of prejudice, occurs through the exercise of power by individuals and institutions against people of other skin color who are judged inferior in intelligence, morals, beauty, self-worth, and so forth. Racism may be overtly intentional, overtly unintentional, covertly intentional, or covertly unintentional. Cultural prejudice is the belief that a person's cultural group determines the standards of behavior by which all other groups are to be judged. Persons with ethnocentric beliefs devalue behaviors that differ from their own and judge other behaviors to be inferior. Cultural imposition refers to the process of imposing an individual's values on others. It is the belief in one's own superiority. Cultural conflict. This may occur when there is a misunderstanding of expectations between clients and nurses, when either group is not aware of or denies cultural differences. Cultural shock is the feeling of helplessness, discomfort, and disorientation experienced by an individual attempting to understand or effectively adapt to a cultural group whose beliefs and values are radically different from the individual's culture. Cultural nursing assessment is a systematic identification and documentation of the cultural care beliefs, meanings, values, symbols, and practice of individuals or groups within a holistic perspective, which includes the worldview, life experiences, environmental context, ethnohistory, language, and diverse social structure influences. To help nurses in conducting cultural health or cultural assessments, you should be aware of a variety of principles, including be aware of the environment, know about community social organizations such as schools, churches, hospitals, tribal councils, restaurants, taverns, and bars. Know the specific areas to be focused on before beginning the cultural assessment. Select a strategy for gathering cultural data. Strategies may include in-depth interviews, informal conversation, observations of everyday activities or specific events of the client, or survey research, and a case method approach to study certain aspects of the client. Identify a partner who will help bridge the gap between the cultures. Know the appropriate questions to ask without offending the client. Interview other nurses or healthcare professionals who have worked with the specific client to get their input. Talk with formal and informal community leaders to gain a comprehensive understanding about significant aspects of community life. Verify and cross-check the information that is collected before acting on it, avoiding pitfalls and making premature generalizations. And lastly, be sincere, open, and honest with yourself and the client. Although all cultures are not the same, they do share the same basic organizational factors. The organization of these factors within cultures differentiates one group from another. The first is communication. Verbal and nonverbal communication varies across cultures, and if nurses do not understand the client's cultural rules in communication, the client's acceptance of treatment regimen may be jeopardized. Use an interpreter. When nurses do not speak or understand the client's language, they should make every effort to obtain assistance from interpreters. Interpreters should be selected carefully because all persons who speak the language may not be proficient in medical interpretation or cultural issues that are at play. Space is the physical distance between individuals during an interaction. Each cultural group may have varied spatial preferences for personal distance, social distance, or public distance. Nurses should take cues from clients to place themselves in the appropriate spatial zone and avoid misinterpretation of clients' behavior as they handle their spatial needs. There are 4 zones of interpersonal space. There's intimate space, personal distance, social distance, or public distance. Social organization refers to the way in which cultural group structures itself around the family to carry out role functions, decision-making processes, and priority setting. Nurses must still advocate for the individual, making sure that the individual needs are considered within the family decision-making process. In this sense, time refers to past, present, and future time, as well as the duration of and period between events. Nurses should clarify the meaning of time before instituting health promotion and disease prevention strategies to increase their benefits and minimize misunderstandings. Environmental control refers to the way in which individuals view their relationship with nature and to influence factors in the environment that affect him. Biological variations are physical, biological, and psychological differences that exist between racial groups and distinguish one group from another in areas such as growth and development, skin color, susceptibility to disease, and reactions to laboratory tests. These variations can be influenced by nutrition, climate, and disease. Nutritional practices are an integral part of cultural assessment, especially because they play a prominent role in all health problems. Efforts to understand the client's dietary patterns need to go beyond relying on membership in a defined group. Knowing clients' practices make it possible to develop treatment regimens that will not conflict with cultural food practices. Awareness of the religious origin of some dietary practices is necessary to avoid creating additional tensions in the nurse-client relationship as nurses negotiate with clients to meet their healthcare needs. Although foods may differ culturally, excesses often lead to similar risk factors. The relationship between socioeconomic status and health disparities is reflected in life expectancy, infant mortality rates, and many other health measures. Members of minority groups are disproportionately represented on the lower tiers in the socioeconomic ladder. Poor economic achievement is also a common characteristic among populations at risk, such as those in poverty, the homeless, migrant workers, and refugees. Nurses should be able to distinguish between cultural and socioeconomic class issues and not interpret behavior as having a cultural origin when in fact it is attributable to socioeconomic class.